Imagine midnight with a tooth pulsing like fire. There is no dentist, no anesthetic, no antibiotic. Removing it may be deadlier than keeping it. So what did people do? The first answer is surprisingly human. They tried everything. 14,000 years ago, an Italian hunter had a cavity. That person did not simply endure it. A sharp flint point entered the rotten molar. It scraped decayed tissue from the hole. Gregorio Auxilia found microscopic cut marks inside it. The scratches formed before death. This was not modern dentistry, but it was deliberate treatment. Later, farmers at Mehrgarh faced another problem. Farming had changed human diets. More grain meant more carbohydrates. Oral bacteria turned them into enamel-damaging acids. Cavities became harder to ignore. Researchers found 11 drilled molars from 9 adults. They were 7,500 to 9,000 years old. Someone had used a bow drill, picture stone spinning against living enamel. Experiments showed those flint tips could drill enamel, but speed did not mean comfort. Nothing reliably stopped the pain. So treatment began with mixtures, prayers, and patience. Egyptian medical texts listed remedies for aching teeth. Ingredients included plants, minerals, honey, and pastes. Some may have soothed tissue, others probably offered only hope. Sometimes hope was the only medicine. People also blamed invisible creatures. Several ancient cultures described a toothworm. It supposedly burrowed inside and caused the agony. That explanation was wrong, but pain finally had an enemy. When remedies failed, choices narrowed. Drain the swelling, burn the diseased area, or pull the tooth. Extraction sounds simple until the tooth breaks. A fragment could remain, bleeding could continue, infection could spread through the jaw, and nobody understood bacteria. In medieval Europe, people often visited barber-surgeons. The same hands shaved beards and extracted teeth. Some tooth drawers worked publicly in markets. Noise attracted customers and concealed screams. Speed became skill and theatre. Could people simply wait? Sometimes, but abscesses could drain, close, and return. Chronic infection could damage bone for years. Skeletons preserve that history. They show cavities, missing teeth, and infected roots. Ancient teeth record meals, pain, and survival. The decisive change was not extraction. Humans had pulled teeth for millennia. It was organizing scattered craft into knowledge. In 1728, Pierre Fauchard published The Surgeon-Dentist. He described instruments, hygiene, fillings, and disease. Dentistry slowly became a profession, but one ancient terror remained: pain. In 1844, Horace Wells saw nitrous oxide dull an injury. He tested it during his own extraction. Dentistry could finally separate treatment from conscious agony. Anesthesia changed what patients could survive. Before dentists, people never calmly accepted tooth pain. They scratched cavities with stone. They packed remedies into broken teeth. They prayed. They found whoever held the fastest forceps. And when nothing worked, they endured. A modern dental chair looks ordinary. It represents 14,000 years of desperate experiments. Dentistry exists because pain demanded an answer.